I'm Dr. Stephen Braddock. I'm a board-certified medical geneticist at SSM Cardinal Glennon Children's Medical Center, where I'm the Director of Medical Genetics. I'm also the Director of Genetics and a Professor of Pediatrics at St. Louis University School of Medicine. When I was doing my pediatric training, I worked one day at a state home, or what we used to call an institution, where there were a lot of individuals who weren't functioning at high levels, but I had no idea why, and everybody just said they're these individuals, patients who had lived here for years and years. And one day the geneticist from that university came down to do a clinic, and all of a sudden each one of these anonymous patients became an interesting story as we went through all the details that had occurred in their lives, why they were having the problems they did, some of which could have been avoided, some of which are inherited, and it became a puzzle to me. It's, so I liken it now when I lecture the students and residents to a little bit like Sherlock Holmes. We get a few clues, we try to put pieces together, we try to see what the big picture is. Is there a genetic condition going on? And if so, what do we need to do about it? What's it mean for that individual, for their prognosis, for treatments? What's it mean for recurrence risk for young families or who are planning more children in the future? I like to see patients at Cardinal Glennon because it's a relatively small children's hospital focused on kids, which has open arms and accepts people with all different conditions to at least discuss whether or not we can provide options for them. It doesn't turn anybody away at the door. And I think that that's something, particularly in current medical times, is important to do. The staff is very friendly, there's smiles all around, the administration is supportive of what we do in genetics, and it brings its own sense of comfort. And I think one of the reasons that we can provide comfort to our families along with their medical care is because the entire environment is like that. And that makes it easy to walk down the halls. It makes it easy to go to clinic where everybody has a conversation, everybody's open to talk about, and it's not a feeling of a rat race where we're all just trying to get ahead of each other.